some health experts are doubting claims by President Akufo-Addo that his government's COVID-19 policies have resulted in a significant drop in active cases. In his 15th address to the nation, the president mentioned 4 out of 16 regions, Savannah, Upper East, West, and Northeast, are without any active cases. And an epidemiologist and senior lecturer at the University of Ghana Medical School, Dr. Benedict Calistego, doubts this claim. He will be joining us shortly. But before that, let's hear from the president.
I indicated that a closer look at the data points to the fact that we are steadily on the path towards limiting and containing the virus and ultimately defeating it. And I requested all of us to pay particular attention to the number of active cases. As of 24th July, the number of active cases, i.e. persons with the virus, stood at 3,307. As of Saturday, 15th August, 3 weeks later, the number of active cases stands at 1,847. This is a clear indication that government policies are working. Currently, there are no recorded COVID-19 cases in the Northeast, Savannah, Upper East, and Upper West regions. And I charge their residents to do everything possible to maintain that situation. Greater Accra, Ashanti, Central, Eastern, and Western continue to be the regions with the highest number of active cases. Thus far, a total of 40,567 persons have recovered from the virus. This means our recovery rate has improved from 89.5% to 95.1% in 3 weeks. Our death rate continues mercifully to be low at 0.5%. Happily, there are no backlogs of tests at any of our testing centers.
I've been joined via Zoom by Albert Sori, Joy News correspondent in the Upper East region, one of 4 regions without an active COVID-19 case. Albert, last Friday when we spoke to you, you indicated that though there were no active cases, there were samples of suspected cases that had been sent to Tamale but were yet not confirmed. Is there an update on that?
Yes, Aisha. This evening, again, I spoke with the Regional Director of Health Services, Dr. Wilfredo Fosu, and he has told me that up to now, they have not yet received the test results for the samples they sent to Tamale. They are expecting information as to when they can expect the results from tomorrow. So as we speak, they are yet to receive the results of the samples that they sent for testing.
But talking about COVID-19 protocols, has the situation changed yet in the region? Because I remember the last time you spoke about how people were ignoring them.
Exactly. So the situation with gatherings is that they are still maintaining the protocols. The challenge is when you go to town, people tend to still not wear face masks and all of that. So not much has changed as far as that is concerned. But again, because of the update we got last time concerning the preparations of the Navrongo Health Research Center to test samples, the health director this evening has told me that plans are far advanced. In fact, sorry, as we speak, what they are waiting for is a few last-minute things they need to do, and then to have some officials from Noguchi come down and then collaborate with the staff they have recruited here to do some training before the testing will start. So hopefully in the course of the week, that will be done. And latest by next week, the Navrongo Health Research Center should be on the way to be able to test COVID-19 samples.
Albert Sorry is our correspondent in the Upper East region. We'll be getting to the Upper West region and speak with Rafiq Salam. Rafiq, is the situation different at your end? Rafiq, you're muted. Kindly unmute.
The situation in the Upper West region is, hello?
You're on Joy News Prime, and I can hear you loud and clear.
The situation in the Upper West region is not different from that of the Upper East region. Samples have been sent day in, day out, but they are yet to receive the test results of these samples. I have checked with the Health Directorate in the Upper West region here, and then the last time that they received samples or test results from Tamale was somewhere around the 27th of July, 2020. And those samples were sent to Tamale on the 5th of June. And so last week and even Saturday, results were sent from Tamale. As I speak to you now, they haven't gotten the results yet. And so they have huge samples, over 1,000 samples they are waiting for. And I can even tell you that some of the health authorities are telling me that they have even forgotten of some of the test results because some were sent over 3 months ago, and they don't think that it will even be useful for now.
Rafiq Salam is our correspondent in the Upper West region. Dr. Benedict Calistego is an epidemiologist, and he says the figures being churned out isn't a true reflection of what's on the ground. We'll try and get him on Zoom for more on this, but listen to him earlier.
We need to look at these pieces of information and the data carefully. It is one thing having data and another thing interpreting or misinterpreting the data. We have been testing for cases and picking up cases. Over the time, from the time we started this management, the number of testing is gradually declining. We are no longer doing aggressive testing as we used to do. Now, the number of active cases we have at any point in time is a direct product of our testing rates. If we are testing more and the disease is in the community, we'll be picking up more. If we are testing more and the disease is not there, we'll be picking up less. However, if we are testing less, it stands to reason that we would pick up less. So the number of active cases is just one side of the story. For any communicable disease, there are two groups of people you worry about as far as transmission is concerned. The active cases, those who have been diagnosed as having the diseases, that's one group. The second group are those who are asymptomatic but still have the capacity to transmit this infection. We refer to them as carriers. For the active cases, we have identified them and we are in the position to implement our measures and treat them.